A 52-year-old man walks into your health facility. He reports generally feeling well, but sometimes give history of headaches as well as dizziness. On your examination, you carry out a blood pressure check, and on 3 occasions you find that it's elevated, about 165/98. He reports that he has a family history of hypertension. He doesn't carry out any physical activities, so he's inactive. He eats a lot of salty foods as well as he's obese. So what do you think is the diagnosis in this regard? Well, I'm Dr. Farida Rajan Ibrahim Omasundi, and today I just wanted us to talk about hypertension, and I wanted us to start with a case scenario. So why are we talking about hypertension? Hypertension is very important because this condition is a silent killer. It's a silent condition, and according to the World Health Organization, it says that over 1 billion people worldwide are living with hypertension. So you can understand how important it is to talk about this condition, because basically most people don't know that they have this condition. So what is hypertension? Hypertension is constant elevation of blood pressure, So basically we have a standard of the normal. So the normal blood pressure has to be anything 120/80. So it's basically a constant elevation of systolic as well as diastolic blood pressure above the normal, which is 120/80. So what are the risk factors that you should be aware of? There are various risk factors that will include things such as age. So as you advance in age, that can be a risk factor. If you have a family history of hypertension, if you don't do any physical activity, so physical inactivity, things such as obesity, and having or eating a lot of salty foods as well, that's also a risk factor. Please take note of that. And also things such as sedentary lifestyle, drinking, smoking, all those can pose as risk factors for hypertension. And what are some of the signs and symptoms that someone should be aware of? So someone can come in complaining of headaches, dizziness, heart palpitations, even vision. Sometimes even vision can be affected to some extent. And why are we talking about hypertension? This is because it's a silent killer condition. It's a silent killer disease because many people worldwide don't know that they have hypertension. And mostly it also has adverse complications. So you find that these patients can come in with stroke, heart problems, kidney problems, all those issues. So I just thought that it would be important to discuss some of them things as pertaining to hypertension, and I hope you consider routine checkups because this condition has a lot of people are affected and most of them don't know. So thank you and see you in the next video.